I just, should I just get going?
No, I will introduce you first.
Okay.
Es en inglés, pero creo que aquí dice, sí, Language Interpretation Available, click here. Entonces uno elige.
Bueno, buenas tardes a todos. Gracias por estar hoy acompañándonos. Primero, explicarles cómo pueden seguir la conferencia de Emma en dos idiomas. Vayan a la barra del Zoom, cliclean donde dice más, luego donde dice interpretación y allí eligen el idioma. Entonces, dicho esto, mi nombre es Andrea Rodríguez Quiroga y les doy la bienvenida en nombre de la Fundación Turning Point para la Salud y la Sostenibilidad. Y también agradecemos mucho la participación activa de la Sociedad para Investigación en Psicoterapia, SPR, en este evento. Tenemos el honor de contar hoy con la doctora Emma Lorenz, quien tiene una destacada formación en física, química, comunicación científica y neurociencia. La doctora Lorenz es una reconocida experta en la interrelación entre el cambio climático y la salud mental. A lo largo de su carrera ha realizado charlas y conferencias dirigidas a audiencias especializadas en salud pública, neurociencia, expertos en políticas, científicos del clima, educadores y estudiantes. Entre sus participaciones más destacadas se encuentran sus presentaciones en la COP26, COP27, COP28, la Global Mental Health Action Network y en otros eventos internacionales de relevancia. También cuenta con una trayectoria destacada como investigadora. Ha publicado múltiples artículos académicos. Algunos de sus trabajos más recientes examinan cómo el cambio climático actúa como un multiplicador de riesgos para la salud mental, afectando desproporcionadamente a las poblaciones vulnerables. Actualmente dirige el Centro Climate Cares del Imperial College of London, donde colabora con otros expertos para profundizar en las interconexiones entre el cambio climático y la salud mental. Además, lidera la iniciativa mundial Connecting Climate Minds. Ahora los invito a prestar atención a la presentación de la doctora Emma Lorenz, en la cual abordará uno de los desafíos más importantes de nuestro tiempo: salud mental y cambio climático, retos en la práctica clínica, la educación y la investigación. Después de la exposición, te habrá tiempo para que ustedes puedan levantar la mano y preguntar. Bueno, te dejo, Emma.
Thank you so much for having me, and I really appreciate the opportunity to present in two languages with the help of the interpreters. So I will do my best to speak clearly and slowly, which speaking slowly is not my forte. So I will do my best, but thank you to the interpreters and to all of you for coming. So I'm just going to share my screen and we can get started. So hopefully that's clear coming through. Can I see a thumbs up that that's okay from the organizers? Great. So thank you for that very generous introduction. So I lead the Climate Care Centre, as you heard, and I've been working at this nexus of climate and mental health for the last 5 years or so. Before I get into the evidence around the interconnections between climate change and mental health, and also what we have heard from people around the world across different sectors around how people in different sectors can start to address these issues, I wanted to hear from all of you. So if you're able to, on a device, your laptop, your phone, however you're joining this event, I wanted to use something called mentimeter.com. If you can type in mentimeter.com, it'll ask you for a code if you give them this code, or you can use the QR code. The code is 18051572, as you can see on the screen. And I'll just give people a moment to do that, and then I'll open up the room, the Menti room, just so we can hear some initial impressions, because I know you're probably coming at this topic from different perspectives. Okay, great. So hopefully people have been able to find that. And I'll just go to launch. So if I can make this as big as possible. Oh, maybe it's making me, oh, very sorry for this. I think it's making me sign in, which I wasn't, I was already signed in, I thought before, but gosh, okay. We might go on with the presentation while I see if I can work that out. And maybe in the chat instead, if we can ask you, the first question I wanted to ask you was around why you're here today. So if you want to just put in the chat, if you're able to share with others around why you joined today, that would be great. And that can be, you know, you were interested to learn more, you wanted to, you know, you already know about this topic, anything you wanted to share that you particularly wanted to find out. Just curious. Thank you. I've got a comment there. If anyone else wants to share what brings them here today, I would like to learn something about the nexus of climate change and emotions. So someone particularly interested in emotions, thanks for that. Anything else that brings you here today? To learn about a current topic. Great. And if anyone would like to share what comes to mind when you think about the climate crisis? Someone saying they're also concerned about climate anxiety in young people, involved in making a film on the subject. Very interesting. Thanks for joining. Some other experiences I'll have to translate. Thank you so much. If you'd also like to share what comes to mind when you think about the climate crisis, that could be a thought, it could be a feeling, it could be a couple of words that kind of spring to mind based on an experience you've had around the climate crisis, or when someone says climate change or the climate crisis. Okay, I've got fear and anger. Thank you for sharing that. Concern about the future for grandchildren. Thank you for sharing. I know for myself, I can definitely have a whole range of very strong emotional responses at times. To learn how to care for ourselves and the environment, wanting a better world for future generations, concern. So there's both a mixture of concern and some of strong emotions, and also a desire to see a difference, desire to see the future be safe, be good for the future generations, anger and learned helplessness. It's very interesting. We'll be talking a bit about helplessness as well. So yeah, thank you everyone for sharing. If you want to keep sharing with others in the chat, I know that I was hoping with Mentimeter it's anonymous. So thank you for those who are willing to share publicly, but really appreciate getting to hear that you're hopefully not alone in what you're thinking, but coming from different angles. Responsibility, eco-anxiety, lots of different thoughts there. So thank you so much again. And so from my perspective, just want to share whether you're coming at this more from a mental health angle or more from a climate angle. Why is this important? So mental health is actually now the top health concern globally. Ipsos Global Health Service launched a report just a few weeks ago, and across 31 countries, which included high-income, low-income countries, mental health is now the top health concern for people in those 31 countries. And the Lancet Psychiatry Commission on Youth Mental Health also came out in the last month or so. And they're also noting that there is rising mental ill health around the world. And it's now entered what they call a dangerous phase for young people. They've seen an alarming upward trend in poor mental health. And they say this signals a warning that global megatrends, including the climate crisis in the past 2 decades, have harmed the mental health of young people and increased mental ill health among them. So we're at a very concerning point for mental health. We're also at a very concerning point, as many of you put in the chat, around climate and environmental change. So we know that we're living in a critical time, and I will get to the good news later, or what I see as the good news, and how we manage some of these emotions. So I know even reading these facts might bring up strong emotions, but we have now surpassed 6 out of 9 planetary boundaries, where we can live within a window on Earth that's sustainable. Any further delay in concerted anticipatory global action on adaptation and mitigation for the climate crisis will miss a brief and rapidly closing window of opportunity to secure a livable and sustainable future. The thing is that people know this now largely, right? And they want change. But often people don't know what to do. So actually, what global surveys have found is that there has been very good work, often from the fossil fuel industry, to say that people actually don't care that much about climate change, climate policies. There's too much sacrifice, it's too expensive. But actually, the vast majority of people support climate policies. This is data from the US, but actually they estimate that only the minority of people would support them. So there's this big gap between how we think people feel and how they actually feel. And around the world now, there's widespread support for climate action, with the vast majority even expressing willingness to contribute part of their personal income and endorsing pro-climate norms and policies. But how do we enable people to cope with the changes that are coming, and that these changes in policies and ways of living and being and all aspects of our society, they are all going to have to change? And how do we support people through that change? What the IPCC reports say is that resilience is fundamental, but climate resilience, in their definition, describes not just the ability to maintain essential function, but also the capacity for transformation. So it's going beyond this sort of bouncing back, but how do we provide communities with capacity for transformation? So if you care about mental health, I'm going to argue that climate change matters. It is a risk multiplier. Its causes overlap with many other causes of poor mental health and exacerbate them. And its consequences are undermining action for good mental health around the world unless addressed. If you care about climate change, mental health matters. So human health is a powerful lever of climate action. It needs to be central in the narrative. This is not just about concentration of gases in the atmosphere, but ultimately it's human health that will be the ultimate cost of the climate crisis and the ultimate benefit of action. But we need to embed this psychological resilience for societal transformation and climate resilience. There is big alignment, but as I'll explain, between policies and actions that are needed for climate and needed for health and social care. And seeing that alignment can help strengthen implementation and uptake. We're also seeing that people working and studying in these spaces are burning out. So we need to make sure that the work people are doing within climate spaces are sustainable. And also the frontline workers from a health perspective who are seeing an increased burden in their work due to climate change. So the climate emergency is a mental health emergency. There are deep interconnections, as I'll explain. So just to very quickly say about the Climate Care Centre and where some of this information I'm going to share comes from. So the Climate Care Centre has evolved over the last sort of 5.5 years in response to many different strands of my work and life coming together, but primarily seeing youth mental health worsen and seeing that while the finger was being pointed at social media and exam stress and all these relevant factors, what wasn't being discussed was the context that young people were growing up in, the world that they were inheriting, and how that compounding uncertainty and stress might be affecting their mental health and well-being. And so over the last years, we've been lucky to work across many different spaces, across research, across policy, across intervention design, across practice, and looking at lots of different causes of the way that climate change impacts mental health, but also lots of different solutions, and also working a lot in policy spaces. But a big challenge we've seen across all of those spaces is disconnection. So we've seen that a lot of the research and the evidence that I'll share is coming from global north settings or high income settings. And often it's not centering the lived experiences of people who are already living with the changing climate around the world, and often also have their own solutions. And we're seeing that tools and solutions in different spaces are there, but not coming together. So the Climate Care Centre is really about trying to foster that connection between different disciplines, sectors, countries, and cultures, so we can collectively protect mental health in a changing climate while building psychological resilience and using climate action to promote the conditions for good mental health. So one thing we've done over the last couple of years is connecting climate minds. And I'm mentioning this now, and just because I'll go into more detail later, but some of the evidence and particularly quotes that I'll share will be from this. So I wanted to tell you where this is coming from. So over the last couple of years, we were lucky enough to build communities of practice in all 7 Sustainable Development Goal regions, including lived experience advisory groups, youth ambassadors, regional community conveners, and co-conveners, again, across many different disciplines, cultures, and sectors, and over 960 experts in over 90 countries came together through dialogues, through events, through surveys, to develop agendas for research and action that would identify priorities to understand and address the mental health burden of the climate crisis. And I'll share some of those insights and calls to action later. So we were lucky enough to work with many, many groups around the world. These are some of the lead organizations you can see around the world, and they worked with many others. So each community was structured like this with the central team, but also reaching out to lots of different groups. So we had dialogues, including understanding what and how to do this work, and also working particularly with young people, Indigenous communities, small farmers, and fisher peoples. So across the dialogues, we generated 10 regional and thematic agendas, 25 case studies, and 35 lived experience videos, which are now all on our global online hub. So we heard through all of these stories and dialogues how the climate crisis and the mental health crisis can currently be in a vicious cycle, where the climate crisis is impacting and multiplying the risks to mental health, but in many cases, that can undermine the capacity of communities and systems to respond to the crisis itself or take preventative action. For instance, talking to farmers in Africa, one of our amazing colleagues working to support them in Kenya was saying, farmers are saying, well, yes, we know we need to plant different crops. We need to do all of these different things to start to cope and adapt to what's happening. But, I can't get out of bed in the morning. And many communities are saying, well, we're just not growing stuff anymore because it's too hard. And then that flows on to food insecurity in that community, and that has all sorts of flow-on effects, including for mental health. So there's and the ability to take climate action. So there's an intersection at the moment that can be a vicious cycle. What that can look like in practice is a whole range of pathways and mechanisms. We've conceived this as a bit of a continuum. This is just for illustrative purposes. But on the left, we can see that there are direct effects of the climate crisis, whereby if you're experiencing directly extreme temperatures, directly experiencing an extreme weather or climate event, there's going to be mental health impacts that I'll describe. But there's a whole range of other things that climate hazards lead to, including crop and livestock damage, forced migration, changes to livelihoods and economic situations, disruptions to health systems, to education, breakdown of communities and bonds. And also on the right, it's not only experiencing these things, but witnessing them, witnessing the landscapes around you change, and witnessing or learning about this, including in schools, including on social media, including from the news, but also witnessing it happening to people and places you care about. And this can lead to a whole range of mental health outcomes. Sadly, we see more cases of suicide and suicidal thoughts, new cases of diagnosable mental illness or worsened symptoms for people who live with mental illness. Also, people who already live with mental illness are particularly susceptible to many of the risks associated. So they're more likely to die in a heat wave, for instance. And there's worsened population mental health and mental and emotional distress. And there hasn't been a lot of economic work done to actually, well, first of all, to understand there's a lot of missing data around the true burden of this, the true prevalence around the world, for many reasons I can unpack. But the first estimate of this extra burden from climate hazards, air pollution, and lack of green space will cost US 47 billion per year. I should say this is by 2030, and accelerate to over 500 US billion per year by 2050. That's just the excess mental health burden. So I'm just going to zoom in now a little bit to the evidence around some of those pathways and mechanisms linking the climate crisis to mental health outcomes. Temperature is a big one. There's many different pathways and mechanisms by which temperature affects mental health outcomes. We've done some work at Climate Cares on a meta-analysis and systematic review. One of the things we found was a 10% higher incidence of hospital attendance for psychiatric disorders in heat wave versus non-heat wave periods. We also see, sadly, higher suicide risk at higher temperatures. A report that came out for London around climate resilience said that physical and mental health can be severely impacted. The Environmental Audit Committee heard that suicide risk is twice as high in the UK when the temperature was 32 degrees rather than 22 degrees. We see people who already live with mental health conditions being at higher risk. So in 2021 in British Columbia, there was a heat dome effect, and 8% of the people who died had schizophrenia, which is way higher than the less than 1% of the population who live with schizophrenia there. We also see a range of other effects. We see impacts on sleep. We see impacts on aggression. We see social isolation, people not being able to go outside, not being able to exercise, see their friends, children not being able to play, disruption to education, increases in conflict. You know, we've sort of probably all been there when it's really hot, and all of the flow-on effects. The other thing that can happen if you're experiencing directly an extreme climate or weather event is a whole range of mental health challenges. And again, these are typically hidden costs. So when the media reports, for instance, on the disasters that are happening around the world at the moment, they'll usually talk about the number of deaths. They'll talk about the cost to building infrastructure. But what they don't necessarily talk about, including over time and in years later, is the toll on people's mental health. So this was from the Climate Council of Australia, these numbers, people who've been affected by climate disasters in Australia over the last years. And you'll see the vast majority have symptoms of anxiety, about half have symptoms of depression, a third have symptoms of post-traumatic stress disorder, disruptions to sleep, impacts on relationship and alcohol problems. And what we're seeing is that with the climate crisis, there's more likely there's repeated events. So for instance, with repeated flooding, there can be long-term mental health challenges, but importantly, a cumulative toll. So maybe the first time you can recover, but then the next time and the next time. And also people know now that it's more likely to happen again in the future when they've just faced something really scary and difficult. And we see that these can be long-lasting effects. They don't have to be. Some people, of course, recover. Some people show post-traumatic growth. With the right support, these effects don't have to be so bad for everyone. But we do see a range of stresses, including when we think of children and young people and how this might affect them in their early development. We also see that climate change disrupts what we know is good for mental health and well-being. And this is important to see that there's these really deep interconnections between all of these different pathways you might be interested in, whether it's gender equality, food and water security, forced migration, livelihoods and cultural practices, including for Indigenous communities, air pollution, different experiences. The climate crisis is essentially worsening these conditions. And often there is common causes, and therefore, hope we'll get to in a moment, some of the common solutions. But it's important to see these range of pathways. I just want to dive more deeply into one of these, just to give an example. So air pollution, it has a common cause. We know that burning fossil fuels, for example, leads to both the climate crisis and air pollution. The climate crisis also worsens air pollution, including through wildfire smoke and including through higher temperatures and humidity, changing air pollution even in cities. And we're seeing increasingly over the last years, more and more evidence of how air pollution is linked to both acute and chronic effects on mental health. So we can see increases in suicide risks around spikes in air pollution. We can see that people who are exposed to air pollution can be more likely to develop a whole range of mental health challenges, neurodevelopmental and neurodegenerative disorders. And this is including even in utero or in early childhood, and there can be epigenetic changes. So if people are being exposed to wildfire smoke even before they're born, for instance, what that can do to their risk across their life and even potentially their children's risk. So we need to really understand how all these things are connected, but more than understand, to advocate for this and make sure it's part of what people know is happening to them and their families. These are some of the stories that we've heard that maybe illustrate this evidence and data. This was from a participant in our dialogues who said, it's been the most stressful thing to observe how not just the air, the visibility, how we are living in the city in the hot later months of the year. So even my friends who I've asked, my family members, they don't feel comfortable going out. It causes severe headaches and has caused us a lot of stress just in general. So a few things. I mean, one, we can see how people might talk about the mental health challenges. They might use different terms like stress. People talk about getting headaches. We talk about changing their behaviors. But we see, when we're talking to people, how this leads to a whole range of mental health and well-being effects. And also how these things interact. So both temperature and air pollution here interacting. Again, showing the range of both interacting effects of climate change and also the different mental health outcomes. One of the Kenyan farmers in our dialogue said, every season is different now, more unpredictable. The harvest is going down every year. They start cutting trees for charcoal as a coping strategy, but it makes it worse. A lot of depression, hopelessness, and a feeling of not knowing what to do. A lot of trauma. Many talk about suicide and fatigue from farming, connected to lack of sleep, body changes from depression. They isolate from their friends as not coping well. They cope using substances. So we can see that there's really a whole range of things that are going on, and we really need to understand this holistically and understand it as people's lived experiences. Just in terms of this disruption as well of access to healthcare, access to education, one of the young people in the youth dialogues really talked about disruptions to their education and to lots of significant milestones in their life and their relationships. They said the impact of climate change on our learning environment exacerbates existing mental health issues, limiting possibilities, well-being, and educational capacity. So at this point, I hope you don't feel too much like the scream on the right, but maybe you do. I think we are not alone in feeling a whole range of strong emotions, and sometimes a feeling of hopelessness, as someone said, or anger, particularly because of the huge injustices in who is affected here. And so there's a whole range of different psychological responses that people have as well to what's going on. And these are not in themselves mental health issues, but they can exacerbate mental health issues because of the stress of holding these strong emotional responses if you're not properly supported. But it's understandable and even healthy to have a strong response to the facts of the climate crisis. There's different terms that are rapidly trying to be understood in research, things like climate anxiety and eco-anxiety, solastalgia and ecological grief. But really, even though these have terms like the name anxiety and something like eco-anxiety, people often use that to describe a whole range of experiences, including anger and despair, guilt, fear, overwhelm. And these also play out differently in different cultures, different contexts. So in work we've done with young people around the world, for instance, in the UK, young people feel a lot of guilt, whereas in India, for instance, the young people were saying, well, guilt doesn't make sense to us in the context of the climate crisis. These experiences are also shaped by the strength of our connection to nature, by our social and cultural dynamics, and whether we've already directly experienced effects of the climate crisis. It's also fundamentally linked to the inaction of people in power and this sense of injustice and betrayal that's so prominent in the facts of the climate crisis. Some of our data, so we did a study in 2020 before there was any, we were one of the first in the world to survey around this to try and understand around the nature and prevalence and severity of these different responses. And we found in the UK, even in the midst of the pandemic in 2020, that young people reported more distress around climate change. And the 10% who were most distressed, we asked everyone how frequently they worried about a whole range of experiences for their own future. And those most distressed about climate change were more worried about it for their own future than anything else, including jobs, relationships, study, pandemic, politics, etc. And it's striking to me because also the UK is relatively protected compared to many other countries. Again, this also interacts with people's perceived direct exposure. So when we surveyed thousands of young people in the US, we found that when people self-reported direct experiences of the climate crisis, they had much higher levels of eco-anxiety, for instance, but also higher levels of psychological adaptation. They were really wrestling with this in a different way, but they're also making different decisions about their future. So for instance, a third were scared to have children. We're also seeing that this is coming more and more into clinics, and mental health professionals in the UK surveyed reported an increasing prevalence of people coming with mental health problems or emotional distress related to climate change. So they are both a risk to mental health, but they're also important to understand how our emotional responses and our psychological responses link to the narratives we hold about the climate crisis, and also link to the actions that we take individually and collectively. And that goes, both ways. So our emotions can shape our actions, but our actions can also shape our emotions. And while they have been linked to poorer mental well-being and insomnia, distress has been linked to taking action. but not when it's extreme. So when people's nervous systems are completely frozen or completely overwhelmed, we can go into fight or flight or fawning or freezing because of very overwhelming or intense eco-anxiety, and that can prevent action. But we can have high distress and well-being together, but that seems to be linked to being able to hold meaning, hope, and agency together. So all of these things can interact. And if you take one thing away from my seminar, it'd be about interconnection. So we're seeing that participants are noting an observable shift from isolated disasters to overlapping and compounding events, which are more likely to result in long-term and cumulative impacts. And it's important to note that climate and mental health, while there's all these connections, this also sits and is interconnected with wider things going on in the world. We know that the financial and cost of living crises are also partly driven by, failed food systems around the climate crisis. We know it's linked to war and conflict, to pandemics, to structural inequities and physical health impacts, which again link to mental health impacts. So this is widening inequalities. Children and young people bear the massive brunt of the climate crisis, but it's also affecting people working in this space, Indigenous communities, people whose livelihoods and cultures are strongly connected to the land, and people with pre-existing mental illnesses or vulnerabilities. And so we need to take a life course perspective. We're starting to learn that children and young people exposed to air pollution or exposed to extreme temperatures, for instance, or other related traumas, it's changing the way their brain is developing, and it's predisposing them to problems across the lifespan. So what that means is, by advocating to policymakers and making sure that this is accounted for, there is a huge benefit to early intervention and to climate action. And young people, as well as being particularly vulnerable, they also have amazing resilience and skills and want their voices to be heard in these spaces. So this is the agenda from Connecting Climate Minds that was written by young people for research and action in this space of what they want to see and what the priorities are. Just to say very quickly, if some of you are working in this space, that we know that there is also traumatic stress from holding and witnessing this in action, constantly being in touch with these issues, and also not necessarily being in spaces that make space for emotion and for sharing this with each other and talking about how we're feeling. But when we start to see, and when we can really see the interconnections, what that means is we can see possibilities for win-win, sometimes win-win-win-win solutions. So while climate change is the greatest global health threat, it's also an incredible opportunity to redefine the social and environmental determinants of health. The world is changing and will keep changing, but we have an opportunity to change that now for a safer climate in ways that actually provide conditions that are better for human health overall. And it's really important that we center that vision in our narratives. A vision is desperately needed of the world that is worth fighting for, not what we're trying to run away from, but what we're trying to run to. How do we do that, and how do we change minds? We need to be cognizant of how a change in feelings changes minds. And this means we can flip the vicious cycle to a virtuous one, where if we understand that if we can build psychological resilience and understand our psychological responses and their relationship with changing action, we can start to create more social tipping points where we're moving people and connecting people and starting to really see some of these changes, which themselves can help our mental health and mean that we've got more capacity as individuals and communities to contribute more to the future we want to see. Just to give you a taster of some of the ways in which climate and mental health action can be aligned. We see that in the UK, for instance, there's a big push towards the energy efficiency of housing. There was an example of a group in London where a local council connected GP surgeries with a program such that if people came and they were getting sick because they lived in cold homes, and that includes also their mental health, can be very affected by living in a cold home, they would update the building to be more energy efficient. And this has been shown that it's reducing emissions in this from these homes, and keeping people warmer for costing less. And it's also improving their health and making it less likely they go to the GP and use the health system in the future, including their physical and mental health. We also see that if we have more active transport, if we're making in our town planning and in the provision of cycling and walking facilities and making more connected communities, there's a lot of physical and mental health benefits as well as emission benefits. Similarly, with making sure that there is a lot of biodiversity and green and blue spaces, often poorer communities and communities of color are less likely to have access to green and blue space. It means they're more susceptible to extreme heat, because we know tree cover and green space is very adaptive. Also, biodiversity can help with flooding because the water can sink into the soil. And we know there's big mental health benefits from connection to nature. And that also enables people to care more for nature. Similarly, if we're forging stronger social bonds, that's one of the best things we can do for mental health, and one of the best things we can do for communities to be able to support each other and withstand climate shocks and hazards. We heard time and time again in Connecting Climate Minds that the difference between people struggling or not after these climate disasters is to do with the strength of those social bonds. Also, if we want to see participatory action and people being able to take action on the climate crisis, we need to have strong communities. We need to have ways for people to be able to engage. I just want to again note that if you want to see any examples of any programs across research or across interventions, across policy, you can turn to the Connecting Climate Minds Global Hub. I can put it in the chat later as well, but hub.connectingclimateminds.org. And there you can see a whole range of outputs, but also including 35 different case studies from around the world where people are already starting to do this. There is lots of good evidence of how if we care about well-being and we care about reduced emissions, then there's ways to do these two things together. And this is adapted from the IPCC reports, the big climate reports, where if you can improve equity and reduce inequalities in society, if you can foster trust and effective governance, then these are all linked to well-being and reduced emissions. So again, there's lots of ways that we can holistically improve these things together. Just to say around, okay, how do we take some of these narratives that I've just been describing of the fact that mental climate action is mental health action, and take that into our conversations and take that into our work. And also, if you are someone who has tools as a researcher or as a clinician, you have a lot of skills that are useful to help people navigate their psychological responses, to navigate the uncertainty, the complexity, hold paradox. And because what we see is that people are going into doomism or techno-optimism, that either, nothing we can do can make a difference now, or just new technology will make it better, or very black and white thinking of we will win or we will lose, or there's nothing that I can do. So people feel a lot of powerlessness. And many of these responses can lead to inaction, both being overwhelmed with anxiety or grief, or being underwhelmed and denying or disavowing what's happening. But that in itself can be a defense mechanism trying to keep us safe in an unsafe climate. Conversely, there's evidence that hope and agency, but as well as anger, actually can lead to action. And one of the most powerful things that we hear when we talk to people is to help people, including using your skills as a mental health professional, to hold paradox and complexity, and to hold that we don't fall into this black and white thinking or this either doomism or techno-optimism, that we can hold space for things to be bad, for things to be scary, for there to being lots to grieve, and simultaneously that there's things to hope for, and to hold that vision of the future that we want. Because the fact that we're distressed shows that there are things that we care about, there are things that we love, and to hold that vision and be all from wherever point we're at, there's always a better future to be moving towards. So we can hold space for those things together. So what is our vision for research, clinical practice, and education? I want to just quickly introduce that if you're coming at this from a research lens, or if you're coming at this from an action lens, as an educator, as a clinician, policymaker, we'd love you to check out the Global Research and Action Agenda from Connecting Climate Minds. It has these two aspects, both priorities for research and priorities for action, but we see these themselves as very deeply interlinked. And I'll just go into a bit of an overview of what the agenda holds and what recommendations came out, because these are not just my recommendations. This is from 1,000 people across 90 countries talking about this for many, many hours. What came out of the global research agenda is foundational research themes. There's a lot in the climate and mental health field is moving extremely fast. Like when I started this 5 years ago, there was, maybe a handful of papers. There's now that many papers coming out sort of every day. It feels like this is very rapidly evolving. But again, there's still big gaps around terminology, conceptualizations, data sets and metrics, and learning from existing and different knowledge systems and practices. So I'll go through those foundational research themes, but also we have these 4 high-level research categories where there are big gaps, and within those, we had priority research themes and questions. The high-level categories are the impacts of climate change on mental health, the risks and protective factors, the pathways and mechanisms by which climate change impacts mental health, the mental health benefits and risks of climate action, and mental health interventions in the context of climate change. And so within, this is just a way to see it in more detail, that within each of these categories, there's different research topics and then different priority questions. So this just lines and dots represent those. And then we did a prioritization exercise using a survey of global experts to get down to the top 2 research questions within each category. And you can see all of this in the agenda, and I'll put that in the chat. So across the foundational research themes, the first one is being able to develop shared terminology and definitions while acknowledging diverse conceptualizations. So we're still not really at a point with this research field that we even can say, these are the key outcomes we care about for mental health in the climate crisis. And also understanding and bringing in how mental health is understood, how it's discussed, how it's described in different cultures and communities. We know, for instance, that working with our Indigenous communities around the world, it doesn't make sense to them to talk about mental health and well-being that is individualized and distinct and separate from the health of the land, the health of their community, the health of their culture. It just doesn't make sense to parcel it out like that. And so we need to have ways to both bring in those different understandings and knowledge systems, while also making sure that when we go to policymakers, when we go to advocate for funding, advocate for support, and to track this changing burden and how we respond to it, that there is still ways to talk about this, and ultimately going into the second one to appropriately measure this across different countries and data sets and cultures. Just a second here. Is there, oh, is everything okay? I can just hear some background noise. Is that
Please mute your microphones.
okay? Sorry, yeah, I just wasn't sure if you were trying to get my attention, but that's fine.
No.
Sorry, 1 second. I'll just go to where we were. So I'll try and go quickly through the rest. Or I know we're tight for time. Just want to give you some time for questions. But yeah, and also to on the third one, to learn from what's already working around the world in diverse disciplines and cultures. We know that there's great stuff happening. It's not always surfaced, it's not always evaluated, which is partly why we wanted to do these case studies that you can check out on the Global Online Hub. Again, you'll see when you look at the agenda that there were these top questions picked out. This also includes looking, for instance, at the influence of structural inequalities, looking at best by interventions, how we invest in communities, and what are these different risk and protective factors, as well as attributing costs and starting to have this economic perspective, really to be able to advocate at a policy level. Overall, we heard that there is a need to identify and understand compounding mental health risks that are caused not by just one, but these repeated chronic and multiple impacts, and understand this complexity of these multiple and interactive pathways and mechanisms. We need to learn from existing relevant knowledge and solutions, including across many knowledge systems, many cultures, and understand these diverse expressions and understandings of mental health and of climate change and people's relationship to the disasters and the changes that are occurring, how they experience them, how they describe them, and how we do this foundational building of the field so that we can together across different disciplines and sectors work on climate and mental health. Just very quickly to say that in implementing this, we must consider local needs, cultures, and contexts, and identify the factors that make people more become differently vulnerable to different climate change factors, and who hold unique vulnerabilities, but also unique sources of resilience. And we heard of a lot of different groups across the dialogues, including across, for example, people living with disabilities, different genders, different geographies, and people living in different institutional settings, for instance, prisoners, and other factors. So when we go into action, the main thing that we heard is that how research is done matters as much as what research is done. And that there is really a shared vision for research and action that centers and responds to community needs. So it's not just researchers coming in and talking to people and then nothing changes. And also that evidence is really translated into action. And this had these 5 different high-level factors of how we do research by building the infrastructure and capacity, particularly evening up the landscape so that there's more capacity in low and middle income countries to do this research. And we're bringing in methods from different disciplines and different data sets and using that across disciplines and doing it in ways that work at the speed of trust with communities in non-extractive and co-creative approaches. And we make sure that policymaking environments can integrate across climate and mental health. And we're building awareness among many key actors that need to come together to understand and act on this. There are some key challenges we heard, and these are not unique to climate crisis or unique to climate change and mental health, but they certainly can hold back research and action. And this includes a lack of standardized and appropriate methods, metrics, and terminology, research funding and structures that are often not made for working across different boundaries, and don't invest in funding for networks, funding for sustained relationship building. Sometimes there's still extractive practices going on where people's lived experiences and global South expertise are not valued and not centered and are still just sort of used. And decisions are being made, or budgets are being made, funding is being made in silos. And there's still a lot of like missing awareness and understanding around the key actors. We need to make sure that fundamentally we're decolonizing the work in this space. And that can mean, for instance, in the Oceania agenda, they were saying to value Indigenous ways of knowing, being, and doing as equal to Western ontologies and epistemologies. So what does this mean for researchers? This is a lot, but just you can read them in the global agenda. We need to prioritize the inclusion of communities and lived experience experts. We need to convene experts to establish this fundamental field building for climate and mental health, and also make sure it's appropriate for local contexts. Networks are really important. So how can we connect to each other? How can we learn from each other? Where are the platforms that we can share best practice? We made the Global Online Hub to do this. So there's a collaborate area where you can sign up to collaborate, and I'll share that. We want to leverage work that's already happening. So if you're already working in mental health, or you're already working in climate and health, or you're already working in education, or wherever you're working, you can bring in this understanding. This is so cross-cutting, and we need everyone to, whatever they're researching, to think about these different dimensions and build relationships between researchers and decision makers, and establish communities that are open and using data in appropriate ways that aren't extractive. If you're a research funder, we need to, again, connect people across different funding disciplines and fund the platforms that can share these different initiatives and connect them, and fund the capacity and field building, especially for countries and contexts that haven't been centered in research. We know that the vast majority of research is happening in high income contexts, and that's not where the impacts are being felt the most. And mandate that in your funding needs to go to communities and community-based organizations, and that there are tangible benefits back to those communities. Policymakers need to make sure that they're integrating mental health and psychosocial considerations into relevant climate and health policies, and vice versa, climate going into mental health policies, and connect across silos. So often what we see are challenges that, you know, if you invest in climate action, which might be in one bucket of the budget and of funding, then the payoff might come for the health system or might come for other systems. So these aren't being connected. So we need to make sure that there are ways for these to be taken into account. This is starting to happen. Just to briefly say that over the last years, so we put out a briefing paper in 2021 on this topic that's been taken up around the world. The WHO, I was involved in consulting on the briefing paper they did the next year on the topic. Last year, one of my team worked to ensure that she worked with the presidency of COP28 in the UAE to make sure mental health and well-being was integrated into the Declaration on Climate and Health that over 150 countries have now signed on to. We also saw this year at the World Health Organization, World Health Assembly, that there was a resolution on climate change and health that included mental health. And also the IPCC, the latest big climate change reports have included mental health as a big risk, but also, as you saw, the well-being benefits of action also came through. And also just to say, if you're interested in learning more, particularly from a policy perspective, but also if you're coming from other spaces, we have this course called Apolitical on Climate Change and Mental Health. And it's 4 hours self-guided, and we do have paid places where we can fund you to do the course. Okay, just getting near the end. I'm trying to make sure we have time for questions. If you're an educator who's listening in, one of the big things to make sure is that we're integrating both climate change and mental health together into relevant curricula. And this is including training medics, training public health professionals, training climate policymakers, training everyone around this intersection, but also just helping build capacity in children, all all careers in the future will need to be climate careers. Climate will be relevant to all different professions. But also people need to hear the truth, but they need to learn about it in ways that support their mental health. And we know that the skills that requires of sitting with uncomfortable emotions, learning how to hold paradox, learning to be tolerant of uncertainty, learning to build agency, learning to be active in our hope and see that as a verb, learning to make meaning in our lives, even in challenging times, that those skills that we can build into climate change education are also extremely helpful for mental health in general. And one example of this, we're actually doing work on integrating climate and mental health education in schools. We've got a working group from around the world of different initiatives that are happening, and we're going to be working with teachers and with students as well. So if you're interested, please get in touch. But I also just wanted to point out like another example. There's other examples. One is Cities Rise, and they're integrating youth mental health support into educational settings in different parts of the world, including specifically skills and capacities to cope with climate distress and mobilize young people. If you're a clinician, we want to make sure that you know how to recognize and appropriately validate and respond to climate-related distress. It's incredibly important to young people. We've got some papers that young people have written themselves and heard from young people around the world about the need for adults in their lives to really hear the truth of their distress and to not sort of downplay what they're facing. Clinicians can also be part of decarbonizing the healthcare system and seeing mental health care as extending beyond the health system of how can we be training and using the skills that global mental health is already really doing of how do we train like para counselors, how do we train many parts of the community to ensure that there is embedded within those communities that psychosocial resilience and support to help communities cope with climate distress and be able to take action. And another thing everyone can do, including clinicians, is to advocate for climate action as a mental health action, and to see that if we want to protect people's mental health, we need to fundamentally stop burning fossil fuels as fast as possible. And we can see that many of these other climate actions are mental health actions. I just wanted to also highlight that many people ask, well, what do we already know about mental health interventions in the context of the climate crisis? We did a scoping review on this a couple of years ago, and we also looked in grey literature because there's very few academic papers on this, but we knew that there was other interventions popping up. There is a bias because many of the interventions don't have any sort of way of finding out about them, really. They're not on Google, you can't find a website. So most of the interventions we found were in rich settings because there's funding for them. But there is also many solutions around the world in different places. I'd encourage you to check out the paper if you want to learn more, but we found this work can happen across different levels of the system. So from microsystem to meso, exo, macro systems of support packages that can work at different levels to help people's mental health in the context of the climate crisis. And just coming to the end, civil society, who many of you might work with or connect with as well, there is a real need to empower civil society to be part and community-led organizations to be part of the co-creation of climate and mental health research and practice, to be an active partner in research and practice, and making sure that we work in connection with researchers, but also are really leading the work. And we're working on this as part of the output of Connecting Climate Minds. We have a new observatory model we're piloting of bringing together different early adopters who are embedding psychological resilience into climate resilience and connecting with researchers to all learn from each other and to be sharing what works and distilling that out to different levels. So again, if you're interested in joining the observatory, please let me know. And also they can be sharing new narratives, new ways of thinking about this, showing how the future can be better for a safer climate and mental health simultaneously. So overall, climate change affects mental health and well-being in complex and compounding ways that we need to better understand and respond to. And we need to transform at all levels to work towards a future that protects both our climate and our minds. And really responding in collective ways that center this interconnected thinking. And when we really work together, which is what these hands represent, we can respond to the climate crisis that we're facing. And this report from 23 young people around the world said that we all believe a significantly better future is possible. We hope for a radically more compassionate world where values of inclusivity, humility, altruism, and collaboration are prioritized. So togetherness is really powerful. I'd like to thank you. I was going to ask you another couple of questions, particularly how you cope and also what you are going to take away from today. So I'll just stop sharing screen. And if anyone wants to share anything that particularly resonated with them in the chat, any message that they would take away from hearing that, or anything that you find in your work that you're already doing, or that helps you, then please do share. And yeah, otherwise I'll make sure we leave some time for questions.
Thank you so much, Emma, for such an interesting and relevant presentation. Now we are gonna start with the questions from the audience. So if you have a question for Emma, please raise your hand. ¿Alguien tiene una pregunta para Emma? ¿Puede levantar la mano, por favor? Vamos a dar un minuto. Vale, ya tenemos a alguien. Rachel, por favor, ¿nos puedes compartir tu pregunta?
I was interested in what you mentioned. Thank you. It was a really interesting presentation first. But I was interested in what you mentioned about the kind of how you help people to stay in the middle between being very defended and sort of perhaps ignoring the issues and being very overwhelmed and unable to do much. And I just wondered, I guess, thinking from a research perspective, if you know if anybody's developed or thought about sort of a scale of measuring where people are on that spectrum at all?
Yeah, thanks, Rachel. Great question. So this is a really rapidly evolving research space, and there's been a bit of a proliferation, I would say, of metrics around climate anxiety, climate worry, eco-anxiety, climate distress. And some people are now starting to look at sort of these different levels of anxiety or distress and where it's maladaptive or where it's adaptive. So when is it linking out to action? When is it people are just becoming overwhelmed? But in terms of how we help people stay in that space, this is quite a new area where intervention research is really lagging at the moment behind the sort of trying to characterize the problem and the challenges. But there's a lot we can draw on based on what people are already doing. So there's groups all at lots of different levels. So for instance, the Resilience Project in the UK is youth-led and has peer groups to facilitate forming these communities and learning the skills so that people can sustain their action, so they don't become overwhelmed and they can't do anything, or they don't do too much and burn out. So that's one. I know Turning Point, for instance, are doing work in this space as well to develop and evaluate interventions using also like mentalization tools, using part of our guided journal, which we've developed with young people in the UK with a whole range of activities to help learn processing skills around these different emotions, learn how to build that sense of agency, et cetera, et cetera. So there are a number of these. There's also other programs like the Good Grief Network, and there's a lot of tools from other mental health spaces like existential anxiety, which strongly sometimes links to climate anxiety. There's also work. I was just at a conference actually led by one of the senior kind of climate negotiators for people working in this space at Buddhist Plum Village, where they were bringing in kind of concepts of some Buddhist teachings around how to cope and sit with this in the space. And so there's people who are coming at this from lots of different disciplines of what we can bring to bear to help people within that space. There's a lot within positive psychology as well of, you know, how do we create meaning, create joy, help people not only survive, but thrive and see that happening. But I think one of the strongest things is you can do is not be an individual, and just to connect with others and to create spaces to talk and to connect with others and to learn these ways to regulate our body as well. So there's lots happening, but in terms of it being in the research, that's what's also really missing, is now how do we take some of these ideas or these interventions and evaluate them. I can see some questions in the chat. Are you happy for me to respond to those as well?
Please, Emma, go ahead.
Thank you so much. So I can see, I think it's Tamara or Tamara saying, thank you so much. She would like to know around the experience of an interdisciplinary perspective, what things have made working between different disciplines easier. I think the same person saying, and what's helped in the experiences with policymakers and the good and maybe challenging things around that. So first of all, working across disciplines, I think is fundamental to making progress and actually fostering deep understanding, but it requires time to build those relationships. And we need to almost advocate for this. I found, like, also with funders and with others, that if you want a center lived experience, if you want to work across disciplines, you need to make time to work at the speed of trust, and you need to make time to really build those relationships. I think that things that help is making space for those discussions and those shared learnings. I think also seeing how this is relevant to people who are coming from different backgrounds is very interesting and very useful. And we tried to also do activities in the dialogues where we were doing some things like using words like resilience and asking people what that meant to them from their different perspectives. So if you're a climate scientist or you're a mental health professional, something like resilience will mean something very different to you. So trying to unpack that and start to make more tangible some of those maybe assumptions that people are coming from in these spaces. But yeah, having platforms where people can also connect and find each other is what we're trying to do. So with the Global Online Hub, that's one way. But also the experience with policymakers, I'd say it's mixed, but I would say that there is a lot of overall, I would say a lot of interest at different levels. We've had a lot of interest in the UK. We've had growing interest internationally. But there's sometimes challenges in the way things are set up, that they see that the buckets of funding just don't make it be able to go together. So even in the Department for Education, were speaking to, they were saying, you know, we get this evidence, but we've got this budget line for climate education. We've got this budget line for mental health support in schools, and we can't see how to bring those together. The other thing is just a lack of awareness. So a lot of people, and also seeing the relative priority. So seeing that, you know, health systems are so strained already. Where is this kind of climate as this priority relative to everything else they're facing and people's kind of time and capacities? So I think making sure that people see how this also links to the other things that they're working on, you know, whether you care about gender rights, whether you care about like water security, any of these things, like mental health and climate change are going to intersect with those. So, and also where that they can just be doing the things anyway, but getting more bang for their buck, as it were, by seeing the co-benefits of these actions. So yeah, I hope that is some things. I can also see another hand up. If you want to go to, is it John and Ginny?
Yes, hello, and thank you for a fantastic talk. My interest is particularly in climate anxiety in young people, and I've had some limited experience with secondary schools in the UK. And when we went and talked to teachers, they said that they weren't aware, they read about climate anxiety, but they weren't aware of it being a problem in their pupils. But then when we interviewed the pupils between the age of 12 and 18, most of them were really worried about climate change and their future. And so my question is, do you know if any initiatives that are trying to raise awareness of the high prevalence of climate anxiety in young people amongst teachers?
Yeah, thanks so much. I mean, it's really interesting, that disconnect. And I think we see that in even talking about the policy spaces and things. You know, some of the particularly sort of older generations, I mean, a lot of older people are very worried themselves, right? And worried for their grandkids, etc. as well. But sometimes people will say, well, you know, it's either I don't see this, I don't think it's a thing, or, you know, this is just young people being worried, like, you know, every generation has something, you know, sort of thing, rather than seeing you know, how pervasive and ongoing and compounding these challenges can be for young people. In terms of raising awareness with teachers, so it would be great for you to join our working group. We've got a project at the moment that's going to be working with educators to understand their perspectives on this, and also understand what are some of the barriers to them being able to integrate like mental health within climate education, for instance, and also teach about climate. We also hear from teachers that some teachers are just scared to talk about climate change or to ask people how they feel about climate change, because they don't feel they have the tools to actually support them if distress comes up. So it's like they might not be asking those questions, asking the students, scared of the answers that they're going to get back. And so there's kind of a barrier against that as well. So giving them the tools that they feel comfortable when those things come up. We've got some resources for teachers around eco-anxiety that we've worked on with the Natural History Museum in the UK. We can also share workshops around that, but we're also connecting to lots of others in this space. So I'd love to connect with you, John, on that. Yeah, I don't know if that answers your question, but
No, that's great. I'll drop you an email. Thank you.
yeah. And also just in university students, we're hearing from lecturers, even at Imperial, for instance, that, you know, they're teaching about the climate crisis, and their students, some of them are going in to study these subjects and then starting to be like, I can't study this anymore. I can't work in this space because this is too much. And the lecturers are saying, well, I don't know what to do. Like I'm not trained to cope with this, to help them. So yeah, that's where we see the need for this integration of people who have these mental health skill sets and tools to support those who are teaching in this space and studying in this space.
Tenemos unos minutos para una última pregunta. Si alguien más quiere preguntarle algo a Emma, por favor levante la mano o escriba en el chat.
Está silenciada, Lourdes. Está silenciada.
Lourdes, está silenciada, pero si te pones el... Ya está, ya puedes preguntar.
When you were mentioning about the lack of research, what specific area of research would you say is missing at the moment, and is the lack of research connected to funding? Puedo decirlo en español también.
Yeah. Yeah, thank you.
Sí, sí.
That was clear to me, I think. So, I mean, the main thing I'd love to point you all to, and I'll put it in the chat in just a sec, the global agenda, because that sets out what are the main gaps in research at lots of different levels of detail. But at a high level, there's still gaps around how many people are affected and in what ways in different parts of the world. And so really quantifying that and understanding the nature of those experiences, understanding how that's coming about by this range of different pathways and how those pathways are interacting, understanding and quantifying the full range of ways that climate action can benefit mental health, and as well as there sometimes could be risks to mental health as well, of course. So are we really quantifying and considering those also to enable policymakers to act? And also, like I said, there's this massive gap around evidence on interventions. And it's great if an intervention works, but then, it's hard for me to go to a funder or a policymaker and say, this is where you should invest. This is the evidence around what will happen and how that will help. In terms of why that research isn't being done, it's happening very fast, the field. I think people just haven't, known about this, thought about this necessarily, but there are big gaps in capacity building for the research to be done and led by the people most affected and in different parts of the world. And also there is a big funding gap. So there is increased funding now for climate and health, but most of it is going to like infectious diseases and is funded by like pharma companies and people who there's very little that goes into mental health. So I think it's always the challenge of getting mental health to be seen on par with physical health in lots of these spaces. It's starting to happen. There's funding and calls that are coming out that look at both physical and mental health. But there is definitely a gap, and I would say a gap around funding the research infrastructure. So that connection building, that capacity building, that centering of lived experience research, that requires a lot of building those relationships, building those networks, building that capacity. And that's where it's also sometimes tricky to get funding rather than a specific project.
Thank you. Gracias.
Any other thoughts? I'd love to hear if anyone wants to share anything that they think they will take away, or anything that particularly stood out or resonated for them, or any work you're doing that this is relevant to. I'd love to hear if you're willing to share in the chat.
Well, I think it's so important that you motivated us to a co-joint work, in different areas. So that is something that is not so easy. So thank you very much for doing that.
Thanks so much. I'm just putting it the links in the chat as well, if anyone would like.
So thank you, Emma. We have the links and we will have your seminar on the webpage of our foundation so people can come and see and rethink about it. It has been very, very nice to be with you and to learn a lot about this. So thank you very much.
Yeah, thank you all and for your time and interest and questions, and to the Turning Point team for the opportunity, and also to the interpreters. I hope it wasn't too difficult. It's a long talk, so thank you for your interpretation.
Muchas gracias a todos por venir. Voy a dejar un link de una encuesta de satisfacción. Por favor, los vamos a enviar después por mail, pero nos serviría mucho si pueden contestar estas preguntas. Y bueno, hasta luego y muchas gracias.